Injury management for lower back pain relief. In previous videos, I've talked about how we can relieve stress. But let's just say you haven't seen those videos and you're just finding me now. What are you going to do when you actually do have an injury? First thing you have to start doing is doing less of what caused that injury to happen. Unless the injury was caused by an impact. Let's just say you got hit by a 2x4 upside the head while you're on a construction site. Yeah, you got to watch out. Got to watch out for those swinging 2x4s, and that's going to be painful as your neck readjusts to. You got an impact going in one direction. Your neck is going to have to figure out how to get back straight up, but that's a process that you're going to have to go through. There are other things that you can run into either in your office or on the construction site that create stress, and then you have an injury. The best thing to do in all cases is manage the pain to the point where all of a sudden you're starting to get more comfortable, and then go in the opposite direction of what caused your incident. Now, your doctor, your physical therapist, your chiropractor may not necessarily want to talk to you about what caused it. They just want to fix it for you. You are the one that has to figure out what caused it. So figure out what caused it. If it's you're sitting at a desk all the time and you've got a lousy chair, get a new chair. Get a sit-stand desk. Figure out a way in order to be able to change that, and then slowly get yourself back to whatever is normal for your particular situation. If you work in a construction site, your boots are all wore out, or if you are on the construction site and you're supposed to have metal-toed shoes, they get pretty worn out and ratty after a while. Get a new pair. Figure out how you can be more comfortable in your environment after your injury. Young people, when they injure themselves, generally do some pretty wild stuff in order to be able to get back on their game again. But if you injure yourself and you're in your 50s or your 60s, it's a whole different story. You're going to have to figure out how you're going to sleep properly in order to position yourself for sleep. There are things that can be done there. If you don't ask me, I can't tell you, but I can give you suggestions there. If you have low back problems, there are positions that you can get into while you're watching a movie, while you're sitting at home, while you're doing this, while you're doing that. There are things that you can do in order to be able to alleviate the discomfort. Most of my work ends up being with people who have gotten rid of the acute pain. That's the first step. And sometimes the only solution is painkillers. Watch out for the really strong ones. They work really well, but they have all kinds of side effects. Go as gently as you can into your pain management. Figure out how to make that work. Stay with those things that you know are going to work well, but get out of the habits that have created the problem in the first place. After you do that, you'll be coming back to your workplace a new person, right? Are you really? Are you going to go back into the old habits that created the problem, and then 6 months later or 2 years later you're going to have another injury that's going to be worse than this one you have here? You know, people that eat ice cubes, you're going to damage your teeth. That's simple. You know, it'd be like putting a rock in your mouth and chewing on a rock. That's going to damage your teeth. But why would ice cubes not do the same thing? They're cooling your mouth and making it so that your mouth, then you don't feel it, that you're actually damaging your teeth. But that's a simple habit. I'm not quite sure why people chew ice cubes, but I digress to a certain point. But that's the same as any other habit that you have. You get into that habit, and then how do you get out of that habit? Talk to somebody, figure it out. You know, I have this. The easier that you can articulate what you think may have caused what your circumstance is, do your self-discovery process and figure out how you can dig yourself out of that one. You know, simple solution when you got hit upside the head with a 2x4. It almost is a Laurel and Hardy kind of a moment for us, but for us older folks, young people may know who Laurel and Hardy are, but in the process, it's kind of a, yeah, okay, don't do that. Don't get into that accident. If you're recovering from an accident, don't get down on yourself too much. Work through whatever it is you need to work through, and then figure out how to rehab yourself. There are many people out there that can help you with that. Your attunement with your care practitioner is the most important tool that you have. Don't just go to the first one. If you don't like the person, go to another one. There's lots of them out there. Figure out how you can get out of it and do it the most gentle way that you can possibly get out of it. And then when you get back to your job site, figure out how you can adjust. That's how people make it successfully into retirement or into old age. They're still in good shape by the time 65 comes around. See you later. If there's any information that you want to share with me, the links are below, and I look forward to talking to you again.